Get 6 months of local news for just $2. You get unlimited access to the news and information you need to stay connected to your community. Visit inforum.com/subscribe to get 6 months of local news for just $2.
You're listening to Plain Talk, the voice of North Dakota politics. I'm your host, Rob Port. If I sound distracted, it's because I've been busy covering this story all morning. I'm joined by my co-host, Chad Oban.
He's right of center, I'm left of center, both sides of the political spectrum.
I think it's cathartic. I think it's a necessary and proper debate. I'm glad we're having it.
And honestly, we have to do better.
Okay, I don't know why I'm getting blamed for this, right? Matt was kind enough to point out to me as we begin this show that we recorded. Now, for those of you who don't know, a little behind the scenes, we record the podcast on Wednesdays. Now, we release one episode on Wednesday, the other one on Friday, but we record both on Wednesday. So you're listening to this on Friday, probably, or after Friday at some point. We just recorded Wednesday's show, and right as we start this show, the Friday show, Matt, our producer, helpfully reminds me, Rob, you forgot to introduce your guest co-host, Pat Finken, who's sitting in for Chad Oban. So that was very dumb of me. Pat's the co-host. You're going to hear his voice. And our guest, as we teased on the Wednesday show, is Marvin Lein. He is a retired healthcare professional, 30 years senior healthcare administrative CEO experience, managing large multi-specialty private for-profit physician practices. He worked as the CEO of Mid-Dakota Clinic from 2013 to 2022. Now, Pat, when you and I were kicking around what to discuss on this show, we've been discussing healthcare a lot. And I think the reason for that is, A, it's an issue that's central to the government shutdown that as we're talking now is still, I know the Senate voted, the government's still shut down though. They haven't opened it yet. So I guess we're going to see. Maybe it'll be open by the time people listen to this, one can hope. But also it's open enrollment time, which means people are getting that happy news from their insurers about what their premiums are going to look like this year. And there may be an additional surprise depending on what Congress, the federal government does with subsidies for ACA plans. The premium increases that you're already footing may be significantly bigger if Congress doesn't act. I don't know. But Pat, you suggested having Marvin on to discuss a lot this, and I'm really excited for this conversation.
I appreciate that, Rob. I will tell you this. Number one is I am hopeful that the shutdown discussion opens the door to a larger discussion about healthcare costs and what we're going to do in this country for meaningful healthcare reform to get it right. These premium subsidies are necessary because the costs have become so great that if they don't do something, we can't afford it on our own anymore. So I think it's a timely moment for the discussion to happen, and hopefully Congress takes it upon themselves to do that. But I also have come to the conclusion, and Marv will testify to this in our previous conversations, I've been reluctant to embrace some of the more radical changes. I actually have come to the point now where I think we've messed up healthcare in this country so badly that we have to look at either starting over or instituting radical changes, or this roller coaster we're on is only going to get worse and more unsustainable the longer we go. So Marv, I appreciate you joining us today. You and I have had some good discussions, but I told Marv when I called him and asked him to join us was, whether or not this is the only solution, I don't necessarily believe that. There are a lot of fixes that we could put in. But I will tell you that for the first time in my lifetime, I've embraced the idea that maybe we need to go to single-payer system. Marv, your take on the state of healthcare and healthcare expenses?
Well, as you said, Pat, the trajectory here and has been for quite some time, leading to unsustainability. And we're going to get to the point where Elon Musk making $1 trillion a year is going to be the only one who can afford health insurance premiums. We've run the current model, the free market model, to the point where we can no longer bury, redistribute, hide system-wide costs and make it unavailable and not transparent to the end user. And as you mentioned, these subsidies, the subsidies themselves don't cover the true cost of delivering care, in addition to what the member is paying. There's a lot of costs that get shifted to other entities, other parts of the healthcare system, where we as consumers have been protected from realizing and seeing that for a very long time. I appreciate being on. This is, I hope it's going to be informative. I have a particular opinion, having worked in the industry for 30 years. I started back in 1994. We were just coming into the era where CMS was setting price control rules. They did it with a program called RBRVS, in which they itemized and said, we're only going to pay X amount of dollars for services, and this is how we're going to add up the value of services. And at that point in time, the industry was all up in arms and thought this would be the end of healthcare. This is socialized healthcare, and Medicare is going to go down the tubes, and we all might as well choose different careers. Well, that didn't happen. The system, the marketplace adapted, and we began to realize that we could continue to deliver care, and did so. HMOs came along. That was supposed to be the solution to saving costs. We were going to drive people into lower cost systems, manage the care. And the consumer said, no, that's not for me. I want choice. Don't tell me which physician I have to go to just to keep my premiums down. We ran that model. That was not effective. These are all elements that are contained with what I think we would all agree is a free market economy for healthcare. Would anybody disagree that our model is a free market delivery of healthcare?
Yeah, I completely disagree with that.
We have supply, demand, and price.
Yeah, okay, but the problem with calling it a free market is most of us get our insurance. Now, obviously, talking about care, I don't get the bill for my hospital. My insurance company gets the bill. I pay what's left over. So really, I'm an insurance customer more than I'm a healthcare customer. And the insurance companies do all sorts of things to limit, where I can go and things like that. And I'm not even the direct customer for my health insurance plan. My employer's the healthcare. They negotiate the terms of it. I just choose to sign up for it or not. Maybe there's, depending on who's your employer, maybe there's a couple of different options under the umbrella. But for the most part, you choose what they sign up for, and they negotiate the terms of that a lot of times in what works for them, not necessarily for me, the person receiving the care. So no, I don't think it's a free market at all. And the thing I'm saying that I'm not even arguing necessarily that the free market's a decision, or I don't know how we could even get back to a free market, but I can tell you this ain't it.
Well, let me redefine free market. Again, with any good or service, let's take the automotive industry. You have supply side, you have the demand side, which together drives pricing, correct?
Yeah.
The demand for an automobile, if it's a high demand for that automobile and the supply of it is low, you're going to pay more for it, right? If the
Yes.
supply for that particular model is high, then suppliers are going to want to push their excess capacity and they're going to lower the price, right? They're going to sell 10 cars at $5 versus one car at $20, right? So there's elasticity in all of those elements, depending where one element moves, correct? And it's all dependent upon one thing: the demand for the good or service. If nobody wanted a car, if nobody needed a car, price and supply would be irrelevant because it wouldn't exist, correct? You can go to
Yes.
a car dealer and say, Rob, you can say, look, I want to buy a pickup. I have 3 to choose from. I'm not going to buy the Chevy. I'm going to buy the Ford. Next year, you may do just the opposite.
Yeah.
Right?
I think the problem with this metaphor is that it's assuming elasticity that doesn't necessarily exist in healthcare. If I have cancer, like if I need a car, I mean, there depending on where you live, you could choose to take the bus, you could carpool, you can maybe live without a car, or even if you're going to buy a car, you could buy a Honda Civic or you can buy a Lexus. If I need cancer treatment, I kind of just need cancer treatment, and I'm not going to, there's not like a geo-metro version of cancer treatment. Or I mean, I guess there is. Most people aren't going to choose it.
Yeah. Rob, you just made my next point.
Okay.
Healthcare is a failed free market economy for the very reason you just stated. No one declines the right or need for healthcare.
Right. I don't really want to have a debate about whether or not the healthcare industry. I don't think it matches in a system where I don't have a lot of choice on which health insurance policies I have. I think that this is, first of all, irrelevant to the problem in front of us.
It's not. It's absolutely not irrelevant because it goes to why the system has created a pricing structure that now exists. It's the basic economics of the model that drives where we are today. You cannot get away from that.
Yeah, you guys are actually talking about the same thing, Rob. What you're talking about, what Marv's talking about, the only difference is that you don't believe it's free market. He's saying it's failed free market. And that's either way, we're to the same point.
I mean, maybe it's two ways of saying the same thing. But I mean, I'm not, when I buy a car, I buy the car. When I get health insurance, when I get health care, the insurance company buys the health care, and then I pay the insurance company, or I guess I pay some out of pocket depending on your plan.
And we could continue going down trying to define this, but the reality is that what we have, no matter how you define it, is broken.
Yes.
It is not working. And until we have the will to pursue solutions, we're going to continue going down this path And unfortunately, in this country, there are a lot of these things we have to deal with that we're going to come to a point where what I like to call we have the grease effect, right? Where we can no longer maintain or cover it up or just tax our way or debt our way out of this stuff. We are better off going into today, having a discussion and putting in necessary fixes or starting all over. And one of the things I think we want to talk about is that I think we have a model that works relatively well. Is it perfect? No, nothing we do is going to be perfect. But actually, I think the Medicare system probably is the closest thing we have. Now, unfortunately, Medicare tends to, limit costs, so it gets pushed off on the science or on the private side of the equation. But that aside, it seems to work and something we need to look at to expand. But that's just my own take. Now, I have a list in my research for the show today. I also found 17 other things we could do that would certainly help the case. But in terms of scrapping, starting over again, that model seems to make some sense.
And it makes sense, Pat, for the reason that Rob, you just pointed out. We have to recognize that delivery of healthcare in a free market economy is the wrong economy to deliver healthcare. Medicare is not a free market economy. Medicare is price setting. Medicare is managed delivery, right? Medicare is much more like the European model than the insurance products that you and I purchase on the commercial marketplace, which is the old model that is failing, has failed. So Pat gets to the point. And the reason why Medicare is successful is because it's not the model that the rest of us live with. So adapting.
Well, and in fact, let's remember that government.
I'm getting hives at the statement of calling Medicare successful, looking at the runaway budget that is Medicare. I mean, part of the problem here is we are a nation that is $38 trillion. And I sound like I want to be clear. I am not defending the status quo. And I am tired when I hear people, we got to control costs. And you say, well, it's a problem. We got to fix it. And they start talking about health savings accounts. They say, shut up. I mean, there's nothing wrong with health savings account, but they're not going to solve the freaking problem. The problem is this is out of control. But then on the other side of the equation, $38 trillion in national debt. I mean, the sort of tax increases that it's going to take to try to get everybody on Medicare, that scares the hell out of me.
Well, and Pat's got some.
Let's remember. Oh, go ahead.
Pat's got some comments here about how a transition to the model can actually find dollars that are currently going to profitability under the current model.
Yeah, I mean, you're right. The tax increases would have to be. Keep in mind, though, federal government already insures more than half or provides more than half of all healthcare outlays in this country. So this is not as revolutionary as it sounds because we're already most of the way there. It's picking up you, Rob, and not everybody else that, and what do we have? 7 different federal health programs that all have their own coding system. I mean, it's hugely inefficient. But the bottom line is, keep in mind, this isn't, just more dollars. because the dollars that are on the private side then become available for us to insert into the new program. And the people that enter the program tend to be lower use consumers of healthcare. Therefore, the cost of adding them on a per capita basis is less. Now, does the math work? I don't know. That's something we'd have to, one of these many solutions we talk about. But this idea that we should pump $1.5 trillion in subsidies into healthcare to save it is hardly an efficient answer either. So what is efficient? And you're right, it's not perfect. Medicare is not perfect, but that model does control costs. The idea that we don't let government or anybody negotiate drug prices is ridiculous. We're the only industrialized country in the world that doesn't go in there and negotiate prices with doctors, prices with hospitals, with clinics, with drug companies, all that. But so it's not just enough to embrace Medicare. We have to do all these other things. We have to unify the administrative costs by having one set of coding that works for everybody. Marv's right. Marv, I'd ask that you address this. To a certain degree, it would be un-American for me to say we shouldn't be profit motivated, but there are layers in our current system that is unnecessary in a single payer environment that we could easily then put that into savings to help pay for whatever we do differently in the future.
Oh, I mean, absolutely. We think it's easy to think that drug companies are the problem with prescription pricing, but the reality is they're just following the model that they're supposed to follow. So we've got to get ourselves out of that for-profit model at multiple layers within the system and drive out those costs. And of all the programs here in the US, nobody does that better. I see it year after year when I get the price schedule. Nobody does that better than Medicare because they have the authority to do that. They have a population behind it to drive purchasing in quantities that even the largest healthcare system in the country cannot achieve under the current model. And Pat's right. Over half of every person in the US is on a government program already. The dollars are being spent on the commercial side, having spent 30 years in the industry, in the most efficient way possible when it comes to the end goal, which is delivering care to a patient by a provider.
I will tell you that one of the reasons, because I spent, and I suspect Pat could say the same thing, spent a lot of time advocating against the very thing that we're talking about right now. And some of the things that scared me is the idea of the government being the decider about, because if we're asking them to come in and dictate price controls, they could also dictate access. They can decide, and we see that in some other countries where, they can kind of decide, is that, do you really need your knee replaced, or maybe you're too old to get that. And those are the things that scared me away from it. I could tell you, though, in the here and now, where I am watching, members of my family and myself, frankly, be terrified to go to the doctor because we don't know what the bill's going to be. We don't know what else they're going to find. They sent me for a test. Now, all of a sudden, I've got a $1,500 bill that I got to pay. How am I going to pay it? I'm going to make monthly payments, but then the kid's got to go to the doctor. It piles up, and it's terrifying. And maybe if the solution is to allow the government to make some choices for us, maybe that's it. Because right now, a lot of people are just not going to the doctor. They're paying out the nose for health insurance, and then they're just terrified to go to the doctor and then they don't go until they absolutely have to. And that's the way Americans are living right now. And it's a joke. It's an absolute tragedy of a joke. And other countries, our friends in Great Britain and Canada and Australia and Japan, do this. I feel like we could do it too, and we could make it work. And it ain't going to be perfect, but man, the status quo is horrendous.
Yeah, it's like I said, unsustainable is a polite way of saying it. But nobody should be in a position of questioning whether or not they should go in with heart palpitations because they don't want to get a $50,000 bill for a 3-night stay in the hospital, plus physician bill, plus ancillary services bills on top of it, plus rehab. The uncertainty I think to your point, Rob, is paramount in addressing. The uncertainty for a Medicare member, Pat's now Medicare, proud to be a card-carrying Medicare. I've never met a Medicare
I have not signed
who
up
wants
for
to turn in their
AARP, nor
Medicare
will
card.
I, but Medicare, absolutely.
Yeah, I mean,
And Rob, I think that's the difference for me, right? You know, that transition to where I actually am a consumer of Medicare has taught me that all the things that you are taught in conservative circles to fear, from lack of a better phrase, socialized medicine, isn't how Medicare operates. I'm amazed, quite frankly, at how it operates, but what it covers. But that's not to say that it's perfect, or it's also not to say that it's not without cost to me, which is, I think, the key to making sure that it doesn't also become a huge boondoggle, whether it be copays or, you know, paying something. You got to have skin in the game. The idea that it would be unfettered will create a problem where we have problems down the road trying to fund it all. But a balance of those two worlds seems to make a lot of sense.
yeah,
I agree with that, and I mean, again, you're the people who are listening here to two conservatives who are having an evolution on how to deliver healthcare. Although I would argue there may be a conservative argument for it if you think of it in the context as something. You know, one of my great heroes, Milt Friedman, talked about a universal basic income, and the reason why he argued that that was a conservative is the public sentiment for having safety net programs is enormous. The Americans want safety net programs. The problem is we deliver the safety net programs in this sort of hodgepodge of state programs, federal programs. He was saying, get rid of all that, replace it with one. We're going to guarantee you a certain level of income so you can feed yourself and you can get basic shelter, right? And that's going to replace everything else. Do you want to rise above that? You know, get out there and work for it. But we're going to guarantee you a minimum. And it's going to replace all this. It's going to make it more efficient. There's a conservative argument for that. And I think there's a conservative argument for this, where we have, you know, all sorts of state healthcare programs. We have all sorts of federal healthcare programs. We're doing it all these different ways. Think of all the bureaucracy we could replace. We could replace Medicaid with this. We could replace the TRICARE system through the military with this, the VA with this. If we just said, we're going to do it. If you're an American, you get this. That makes a lot of sense to me. Plus, we couple it with strong enforcement on immigration, you know, to make sure that we're protecting that for citizens. And I think that's a good thing. It's a good place to get. I've come around on this because, again, the status quo is so horrendous. And I think I join a lot of Americans. I am tired of getting punched in the face every year on this. I'm sorry, that wasn't a question, Marvin. I'm just ranting at this point. But I mean, how hard would it be to because I mean, Chad is fond of saying that there are a lot of people making a lot of money from the status quo, and they would fight this.
yeah. Chad's not just fond of it. Chad is absolutely correct. But
Yeah.
that is the model. That's the end goal of the model, right? That's why you have to fundamentally change the model. So this is not going to be easy. You put everybody on Medicare, it doesn't automatically create more dollars to pay for Medicare. You have to do multiple things in which to make sure the coffers remain full. But the total cost of care is going to come down if you eliminate all the redundancy, all the unnecessary costs, all the profitability that each person along the way takes. Insurance companies alone, 20% on your premium doesn't go to healthcare. It goes to share value. It goes to higher level administrative staff, et cetera, to carry out those kinds of programs. You're going to find millions upon millions of dollars in the transition. The question is, how do you transition? That's my opinion, because we have no option but to transition to something else, to some sort of universal. Everybody pays in. Everybody gets access. We manage the cost of that in some way, shape, or fashion that, in my opinion, is not too different than the way Medicare has been doing it for years. I can tell you from a provider standpoint, there's no better payer in the country than Medicare, because they pay on time, they pay accurately, you know the rules up front, members know what's covered versus what's not covered. It is an efficiently run system from a provider standpoint.
Let me ask you this, though. When we're talking about doing this, is it just the payer that we're going to nationalize? I mean, we're all talking about nationalized healthcare, but in some places that means the government runs the doctors, the hospitals, they all work for the government. They nationalize the hospitals. Or is it just we have Medicare and then private providers?
No, whether you have private providers or not, actually, Medicare has developed a model. They've not rolled it out, but 10 years ago, and anticipating the cost of Medicare over time, they've developed a white paper on a model that breaks the country down into regions. Regions have caps on expenditures. Okay. So let's just take North Dakota, which ideally is a nice petri dish, by the way, because if it's isolation, let's just say North Dakota is a region and all the healthcare dollars that are consumed in North Dakota is a managed healthcare dollar. So what happens is that systems in North Dakota are no longer competing for your care, Rob. They're no longer competing to get you to go in their urgent care, which means there are not 5 urgent cares in a 10-mile radius. There are 3 because 3 is the capacity that's needed.
Yeah. There are a lot of North Dakotans listening to this. Like, where are you living where there's 5 urgent care available? Because I live in Minot, the 4th largest city in the state, and there's 1.
Well,
So they don't have to do much to get me to go there. If I'm sick, I'm going there.
right. Well, but in my market, there's 5, and those 5 are not all busy, but those 5 are all staffed up, ready for you to come in, and it's costing the system. So regionally, system-wide, there needs to be a consolidation of resources so there isn't a duplication of resources, which adds cost, and you get the system working together as one. That is a huge economic gain.
Well, but that doesn't happen. That doesn't have to happen just through privatization, or I mean, of bringing the healthcare world into the managed or into the government throes. Because I would argue, man, government doesn't do a very good job in managing healthcare institutions. Where they have proven some ability is in the replacement to insurance, like Medicare. But I would argue that Indian Health Services or the VA, I mean, there are some shining examples on the Hill, but a lot of them struggle to be a good institution. I would also argue that the idea of redundancy and overbuilt can be addressed regulatory, but even through price controls. If there are a limited number of, or if there are limited resources to pay for those services in a community, they're not going to build 5, and they'll close 2 if they have 5 because they can't support it if there's not enough demand for 5 places because they're not getting excess. And that's one of the things to remember in this. In the current environment, there is a cost shift, a rather large cost shift from the private side to the public side. I'm sorry, from the public side to the private side, where shortfalls in what Medicare reimburses or Medicaid or any of that get made up by private insurers. We're enabling bad actors in that world. If we have a situation where it's a reasonable cost containment strategy, you're not going to have the redundancy because nobody can make that work financially. And the minute you take away that, the potential for the influence of that, then you're going to have you're not going to have those motivations to reduce capacity down to what the actual need is.
Yeah, well, but I agree with you, Pat, but there needs to be some coordination of the delivery among the entities involved in the marketplace. And if everybody is operating within a capped budget and there's no antitrust rules to say you can't get together and consolidate your primary care base in the most efficient way, you're going to drive the system to what you just described, Pat, which is a much more effective, efficient system that's right-sized without the unnecessary unused capacity.
I think there may be people listening to this saying, oh, listen to these 2 former conservatives gone liberal advocating for nationalized healthcare. And the point I want to make about this is we're heading in this direction, whether you like it or not. I mean, it's the momentum's behind it. What really scares me, and we're seeing it happen in North Dakota. There's been some debates about bills about it at the legislature, but we're seeing vertical integration now between the health insurance industry and the healthcare industry. So they're already consolidating in the ways that we're talking about it. Only it's going to be on the corporate side where they're not really accountable to anybody but their shareholders. Right. And if we're heading in that direction anyway, and I got to tell you, it's scary. I mean, the idea of my doctor working for my insurance company scares the hell out of me. I don't want that. I think it's a fundamental conflict of interest. So, I mean, if we're going to head in the direction of at least if it's the government, I can vote for somebody. I can put some pressure on a politician to change some things, as opposed to a private sector business, which given the inelastic demand for healthcare, and then we all need it, doesn't really have to be accountable to you at all.
And actually, Rob, and again, I understand what you're talking about. It is a little shocking for two conservatives to take this point of view that, to a limited degree, agree with Bernie Sanders. But the bottom line, yeah, right. But the
Jared
bottom
mentioned
line
Bernie
here
Sanders.
is that I do think it is a conservative argument. I know it's a pro-business argument. Healthcare has become an incredible force in business to interfere with people's ability to compete and to deliver products in the most efficient way and to take care of their workforce, all those things. Insurance, business would embrace the idea that we have some better way of going about this. People who consume healthcare or buy healthcare premiums now would embrace this because we're going to have a fair way of doing that and an ability to actually deliver the healthcare that they need in a more rational way. Now, that doesn't mean there won't be players out there that will use scare tactics, pushing granny off the cliff, and all that kind of stuff is going to come into fray. So it's not going to be easy, but until we have the political will and the strength of character to do this, we're going to continue to do the wrong thing.
Yeah, and I think, Pat, you need the business community behind it because it's killing businesses. Imagine the cognitive dissonance in my office when I am running a for-profit organization, maximizing, as the market says I should, return on my investments, and I get an insurance bill that consumes 20% of that more than the previous year because I'm buying insurance or I'm self-insuring against the cost of my own services. I've experienced that for 30 years, and it's part of the reason why I'm convinced that we have to dramatically do something different.
Well, I think we all
this
agree
gets-
on. I'm sorry. Go ahead, Pat.
I was just going to say, this gets back to my own experience in the business world. The last year that I owned my company, I was proud of the fact we provided full family coverage for everybody that worked for us. Everybody got the full family package paid for by the company. But how long can that be sustained by any company, even my former company, when at that last year, and a small North Dakota company cost me $400,000 that year to do that. When I started it, it cost me probably about $35,000. And now it's up to 400. You talk about business would embrace a solution. Now, I also want to be clear. It's going to cost some money to do this. It's not only going to get paid for by savings, but there are other ways that we can go about this, whether it's a payroll tax, much like how we fund Social Security and Medicare now, or whatever those are, or a VAT tax or a
If you're
sales
getting a
tax or
paycheck, you're paying for Medicare now.
right.
And then you're also on top of that paying for your insurance. Americans have to play. If you tell me that I don't have to pay my Blue Cross Blue Shield premium, that frees up some money that I could put towards this as a healthy, relatively younger. I'm not sure I could call myself younger anymore. I'm in good middle age now. Over the hill,
late 30s, Rob, or what?
For 45. Yeah,
Oh
mid 40s.
gosh,
So
you're 1 foot in the grave.
I'm 1 foot. I am. I'm just about there, practically dead. No, I think there's some elasticity out there for this, though. Yeah, it's going to cost some, but it's also going to get rid of some things we're already paying for. There's a lot of reallocation that can happen that can blunt some of this. But also, I don't want to be a babe in the woods about it either. It's the government doing it. It's going to cost some money, unfortunately. But I don't know of a better way. Marvin, thank you for coming on and offering your perspective as somebody speaking against what you spent your career doing, and now coming on and saying we should stop doing that, what I did all those years, and have the government take over. But I don't know where else to go. I don't know where else to go because you talk to conservatives, we can't do nationalized health. We're going to do health savings accounts or something. They don't work. Nothing else is working. I don't know what else to do, but we can't have the status quo.
No, my pleasure. I'm going to go take a bike ride and try to convince myself while I'm riding that my career doesn't mean I was a terribly bad guy.
Oh, I wouldn't say that. Marvin, thank you so much for your time. Appreciate it.
You're welcome.
Thanks, Marv.
Hey, Plain Talk listeners, have something to say? Call or text Plain Talk with your questions, comments, or headlines you want us to cover.
Just dial 701-587-3141. Leave us your message or shoot us a text with your name and location, and you could be featured on an upcoming show.
Hi, my name is Ashley, and I am in Jamestown.
Hey, Rob and Chad. My name's Tony. I live in Grand Forks.
That's 701-587-3141.
Call us, text us, vent, praise.
We want you in the conversation. Thanks for being part of the show.
Now let's get back to today's episode.
Pat, did you ever think like 15, 20 years ago that you and I would be co-hosting a podcast together wherein we both advocated for the government taking over healthcare?
I'm a Reagan Republican. I mean, Reagan was the guy that famously talked about how, the government is the problem. So yeah, I would never have guessed that. But I've also, I'm now 68 years old and remember and have seen where we got to. I think we didn't have to end up here, but I think that unfortunately we're at a point where we've got to do something radically different because what we're doing and what we've evolved to doesn't work.
And it's not just, it's about the healthcare, obviously, first and foremost, is making sure people get the care they need. But it's also the degree to which we have allowed the mechanisms through which we access healthcare, both the insurance and the providers, have allowed it to become a damper on the ability of Americans to be prosperous. I mean, how many Americans are seeing whatever progress they're making, moving up the economic ladder, moving up the income ladder, just completely blunted, if not eclipsed entirely by rising healthcare costs? I mean, how many Americans, we talk about like people's ability to afford a home. There's a lot of younger, I was just reading an article about the Groyper thing and the Nick Fuentes thing and the author was really trying to understand, why are these young men who are following this idiot so angry? Well, they don't feel like they can ever move up the economic ladder. They don't feel like they can buy a home and live the way their fathers and mothers did. And part of the reason for that is healthcare.
Oh, no question about it. And as I reflect on this, two things. One, first of all, your comment about about health savings accounts don't work and all that. The absolutely true. They're Band-Aids. And it's almost like we have put enough Band-Aids on this problem that we've messed it up so bad because we never addressed the real fix. We're always looking for ways to, let's not go down that path. Let's have health savings accounts. But the health savings accounts may apply some price pressure and some consumption pressure on the system, but nothing like what we've got to do to really fix this. And it's just another Band-Aid that is going to just prolong this dysfunctional part of our economy. And it's a huge part of our economy. Not only that does it affect our business, the ability of business to compete and succeed, our individual abilities. It's a huge part of the overall economy. And yet it's a drag on the rest of it. And we are going to only have the quality of life in this country that our citizens deserve if we allow people to succeed, prosper, and grow. And healthcare is a barrier to that, the way we administer it in this country.
It really is. Here we are. And I hope I have stopped being, and maybe this is part people say, oh, Rob Port's changed or whatever. I've stopped caring a lot about whether or not a particular issue fits into an ideological framework. I just want things to work. I want Americans to be able to start businesses and take some risks, and make some money and be prosperous and raise their families and get educations and do all those things and have some fun along the way. I want Americans to be able to do that. And it's just healthcare is in the way of so much of that. It is such an obstacle. People staying in jobs that they don't want because they can't afford to have the health. They could maybe go out and start a beautiful new business or take a chance on something, but they can't because they need that health insurance. It's holding us back. And I'm thinking about the sort of things that could happen in America if we weren't being held back by it. So we're beating a dead horse here, but it is such a vitally important issue. Hey, I had a story this week, um, about my headline was a stalker in the state house, and I got a ton of feedback. It had a ton of reads, and I got to tell you, Pat, the one question everybody keeps asking me, and I don't have an answer for it, is how was this situation allowed to happen? Now, to summarize the story, if maybe some of you didn't read it, is there was a woman, and she approached me. She wanted to have her story told, so this wasn't me outing her. She wanted her story told. Her name's Heather Trainer. She works in the judicial branch of government. She works in the state capitol. She was dating a gentleman for a long time, and um, things went bad, and he started stalking her. In fact, and when I say stalker, I'm using that because he was convicted of stalking in a court of law. And then he was later convicted also of violating a protection order. But he continued to park next to her at the state capitol. He would, um, I mean, she feels orchestrate ways for him to get into meetings that he was not supposed to be in. The state of North Dakota was supposed to be keeping them apart, which understandably that might be a little tricky, given that they both work in the state capitol. They both, do work for the legislature. And the state just really did a terrible job with it. And I guess I'm looking at it just like how I don't know how this situation was allowed to fester like this. It was shocking to me when I started, digging into the story and reporting it.
Well, I have to tell you that, first of all, it's important to note that he was convicted. One thing to be accused, especially in domestic situations where that can have a lot of um, possible outcomes, but this man was convicted twice on the very charges. How he is still working there, and then having continued had problems in that, just amazes me, quite frankly. That's the thing, the hardest thing I have to understand this is how do we allow that person to keep working there? If he's clearly violating a court order while engaged in his now, if they keep separated, and keep in mind, the onus is really on him to follow the court order. But when he doesn't, the state has a responsibility to step in then and provide a safe working environment for not only her, but all employees. This is just one example of where it doesn't. And I think the state normally is pretty responsible when it comes to people and the people that work for the state. But this is an egregious example. I was like most of the people that responded to your story. I was shocked that this was allowed to continue.
Yeah, and there had been some previous reporting on it. I think his convictions were reported in the news, but they kind of left the impression. I know when I first read the stories before I spoke to Heather, my impression was it was a ticky-tacky thing. It was a relationship that went really, really bad. Just because somebody gets a protection order out against them, I mean, that doesn't necessarily mean they've done something wrong. Now, in this instance, he did plead guilty to stalking, which is pretty incriminating, obviously. But I mean, it was like he had violated the articles made it sound like he had violated the protection order because he went to the Capitol to use the copier. And it's like, oh, he got within so many feet. It's a ticky-tacky thing, not a big deal. And then you dig into it and you find out, no, this was a big deal. There was a lot here that happened. Hundreds of phone calls, driving by her house, accessing her. She had one of those ring cams that he was able to get access to and watch and all these things. I mean, it's scary and it's remarkable. And I hope that at some point somebody in state government acts. And I think it's one of those situations where, the public's owed an explanation. Why was this allowed to happen on the public's dime? And to have a public servant treated this way to where she doesn't feel safe going to work. That's wrong and just not defensible.
Well, and oftentimes when there are these kinds of things that happen in state government, and again, like I said, I think in general they do a pretty good job, but there are always going to be exceptions to that. I'm reminded of the Leo Reinbold thing, right? It was only after it came to light publicly was there any kind of motion to do something about a situation that was that needed to be addressed. And hopefully your reporting on this does that, because this woman and all of state government, all the employees in state government deserve to know that if this is their situation, that the state will take care of their people. It doesn't matter. And quite frankly, it doesn't matter whether you're a private business or a governmental organization. Your employees deserve to know that you will protect them in that situation from the very things that, because this is not just some you're right though, this is not just some ticky-tacky deal. This was, you're innocent until proven guilty. Well, he's been proven guilty in this.
Twice.
And twice, and keeps pouring salt on it. Somebody's got to step in and do something. And I would say that to anybody, whether it was a private business or government, your employees deserve better.
They do. Should we talk about Applied Digital a little bit?
Yeah, absolutely.
I guess you and I haven't talked about the data centers so much. I am generally enthusiastic about data centers. Now I want to make sure that we're careful. I don't want to see us put ourselves in a position where all of a sudden we enjoy low power prices in North Dakota, and we have for a long, long time. I don't want to put that in jeopardy. But as long as we're keeping a weather eye on that situation, I'm excited about this. I think they're bringing in high-tech, high-power jobs. I think it's creating demand for something that we produce a lot of in North Dakota, which is power, and we're creating that demand in the state, which kind of cuts through some of the political mumbo-jumbo around that stuff. And also, you kind of wonder what sort of opportunities it creates for ancillary investment for the sort of businesses that want to be geographically close to these data centers. I just feel like it's a good win-win-win for North Dakota, but there's a weird situation going on in Fargo, and I reported last week, Applied Digital. So what's happening is Applied Digital wants to build a facility near Harwood. And in fact, I think the main part, like the entry part to their facility, is in the city of Harwood, but then other parts are in Harwood's extraterritorial area. Now, Fargo's come along, and Fargo wants to annex that space. And I believe that Fargo is after the revenues that is going to, because Fargo's got some budget problems and they're trying to capture this. Harwood doesn't want it. The people that own the property where the facility is to be built don't want it. Applied Digital doesn't want it, but Fargo's moving ahead with it, and it's kind of stunning to watch, Pat.
It's purely the money. That's what's driving this whole thing. Fargo needs more money, they say. You and I share some opinions of how well they've managed their revenue stream anyway.
Which is not great. If you're wondering how Pat and I feel about it, they've not done great.
No. They have not done well in that regard. So then they're going to go out and try to take this money away from Harwood, which, by the way, is a city that's exploding on the fringe. Why? Because people want to live there instead of Fargo because of the tax structure. But the bottom line is this. I worry about it because it's sending the wrong signal to companies that may want to come here. This is a tremendous opportunity. And, you think about this, and it's kind of like the healthcare discussion we had earlier. I would say that I'm a pragmatic conservative. The true conservative ideology only may have some problems with some of this, but the simple reality is that we have an opportunity in the state. People actually want to come here because it's cold. They actually want to spend billions of dollars to build these things. And I've watched Applied Digital with what they're doing in Ellendale and Jamestown and some of that. This is a good company that delivers on its project.
Yeah, this isn't some fly-by-night. I know we had some others, and I think when North Dakotans first started hearing about data centers, I think a lot of it was tied to crypto, which I think maybe put some bad taste. And there are I don't want to run down crypto either. There are some legitimate things going on with it. But I think there was a feeling that some of this was fly-by-night stuff. That's not Applied Digital. You look at Ellendale, you look at their project near Jamestown, they have been good partners in North Dakota. Stand-up people, they've been accessible, they've worked. The local leaders, you talk to the people in Ellendale, you talk to the people around Jamestown, the local people they've worked with, you talk to the city leaders in Harwood. They're happy with this company. They've been a good partner. These are the sort of people we want coming into our state.
Well, and part of the problem we have is that the very first foray into this world happened up by Williston. And these projects are better suited in energy deserts, places where there's excess capacity or when you can expand capacity at a relatively low cost or dedicated cost to the facility itself. But up in Williston, you had one that came into an area that was already stressed, where additional resources had to be deployed, which led to higher utility rates for the people there. That was the worst possible first project in North Dakota, right? Worst possible way to launch this. And unfortunately, Applied Digital and some of the other responsible players have paid a little bit of a price for that because it starts at rumor mill. But that being said, I grew up in Western North Dakota. I saw my dad close his hardware store because he couldn't make it in rural America or rural North Dakota like so many others. And yet here we are 50 years later. And agriculture has always been the rock that we've built our rural economy in North Dakota. And all of North Dakota is rural, including Fargo. But the bottom line is that then came along coal and that energy source, and then oil. And suddenly there are things going on in this state that you and I could never have imagined when we were growing up. And jobs and high-paying jobs and opportunity and population growth where North Dakota had the fastest growing young population in the country. That's all unheard of for the people that were convinced that Buffalo Commons was our future. This is the kind of stuff, but it doesn't, each of these are a step towards that future, right? We had to have the oil industry because the other thing that happens here is now we have abundant, low-cost natural gas to produce electricity. But we also have the cold weather, which limits the amount of electricity they have to use at these places because it's here in North Dakota. And so it's just another opportunity. But much like Dell Computers in South Dakota, your point, Dell coming to Sioux Falls wasn't the only boon. All the ancillary stuff that came with it. We're only seeing the tip of the iceberg of what's possible for North Dakota on a technological front. And I'm excited about the jobs this creates, the opportunity it creates, the increased tax base to pay the bills. This is a win-win for us if we manage it correctly. Unfortunately, Fargo is becoming part of the problem, not part of managing it correctly.
Well, and for such a parochial issue too, it's not even, they're not even against it. It's just they're greedy, and they want a cut of the pie when it's not being built in Fargo.
Go ahead.
Well, it's being built in Harwood, and when Harwood's extra tourist. But I mean, the case for this is so straightforward. Fargo just needs to fix their budget problems without glomming onto this project.
Well, and there's a reason why Applied Digital has reacted so strongly to this. Fargo is the only city in the state, and largely one of the few cities in America, that taxes utilities, natural gas use, all those kinds of things. There is a direct hard cost. It's not just
although they don't call it a tax, it's a franchise fee.
Right, exactly. But the bottom line is that it's not only higher property taxes if Fargo annex this for Applied Digital, it's also they get the franchise fee. And that's why Applied Digital cares where they're placing these. They wouldn't have chose Fargo on a bet. And because of those extra costs associated with doing business in Fargo. Now, if I'm Fargo, I'm looking at this saying, maybe we better take a hard look at our ability to attract business. Because the real thing here is that they have put up barriers to business wanting to be there to a point now where Applied Digital is fighting the annexation for those very reasons.
Right. And I agree with you that it sends the wrong message. I mean, the message we want as we have this generational struggle to diversify North Dakota's economy, not because there's anything wrong with the things we're doing great now. We just want to do more stuff here. Is that North Dakota, the message to the world is North Dakota's open for business. And the message Fargo's sending right now is we're not really open for business unless, you play ball with us or whatever. The franchise fee. And I actually think that might be the way that they're going about this. In state law, and I think this changed during the 2017 session, they amended it where they can't use those franchise fees for just to generate revenue. Like if it's a fee, it's like it has to be like a user fee. Like it has to be tied to something. You can't just create like a tax where we're gonna levy a tax and then the money's gonna go in the general fund and then we'll appropriate it through the budget process. You can't treat, according to state law, you can't treat a fee that way. And so Fargo just sort of nakedly going after this project for revenue purposes, I think has really built a strong case where they're going to get fought in court and they're going to lose. And by the way, Fargo's track record in court on these matters is not a good one because they keep taking, confidently sallying forth with these issues, and then the court's putting them in their place. This would be another situation. They ought to just let it go. Let Harwood develop it. Let this thing happen. And Fargo, you worry about yourselves and you fix your budget and maybe reconsider some of your policies.
Well, I'll tell you this. I love the fact, and you're seeing what happens when you have the wrong kinds of environment for business to be attractive to your area. Minnesota's got cities that are fighting these centers. As a result, some of those centers are going to go elsewhere. South Dakota just went through this recently, where their anti-carbon pipeline stance cost them some additional industry in that state, not just building the pipelines, but cost them an expansion to one of their ethanol plants for the purpose of
the rocket fuel company,
right? The rocket
no, not
fuel,
rocket, not
GEVO.
rocket fuel, jet fuel.
But it's GEVO, but it's also anybody in that ethanol business or any of kind of the alternatives that are being created with that product. They're not going to want to go to South Dakota. So it shows that when you do this kind of stuff, you just drive it someplace else. It doesn't not happen. You just drive it someplace else. And the unfortunate reality is South Dakota made their chops by attracting business from Minnesota. Well, now they're doing it, and we'll take it. North Dakota, we'd be happy to have it. We're glad to have the business.
And we don't really have enough time to get into this, but I mean, this long-term fight we've had against sort of the populist wing of the North Dakota Republican Party, for the most part, they have not been successful. I mean, they control the state party, but if you look at our statewide elected officials, you look at the majority in the legislature, these are pretty pragmatic. Even some of the Democrats, these are pretty pragmatic, open for business people. South Dakota has gone a different path, and that the news about the carbon pipeline, the news about the jet fuel company, leaving their state and coming to our state, that's the price of that kind of politics. And in Fargo, I wouldn't call their leadership. I think they're more left of center generally. They're not from that sort of populist. That's not the issue there, but it's the same brand of politics where I mean, calling it gangster politics is probably a little strong, but it's not good. It's not open for business. It's not the North Dakota way, and it's not the way we're going to get investment in this state.
Well, and I'll tell you this. I mean, that's not to say, we should have a free-for-all. I think North Dakota does a good job balancing responsible regulation. There are some exceptions to every rule, but responsible regulation to keep the public safe, but also to create the opportunities. We are talking about creating more good-paying jobs, which means more young people stay here, that the tax base gets spread, so there's less that everybody has to pay. I mean, there's too many wins in this situation not to have that attitude, and we have to always be diligent that we keep that, or we do end up with like South Dakota. Because I mean, I remember the blowback against the nickel processing facility in Beulah. You're talking about an era where maybe coal is at risk down the road, maybe not so much during this administration, but these are things that we can do that will replace those industries. And if they don't have to replace them, even better, it'll grow. And we have to have the right regulation to make sure that it's not a detriment. But at the same time, we can ill afford missing these opportunities. And that's why it drives me crazy that Fargo would, do you think that anybody is going to relocate one of these centers now anywhere near Fargo and those jobs
not unless there's a sea change in city leadership.
Exactly.
No. And again, we need to wrap up the show, but North Dakotans we're kind of a product of our own success. I think there's a lot of North Dakotans who think that this is the status quo. I can remember, and I know you can remember back even further. When I first started writing about politics in North Dakota, I was writing about a shrinking population. I was talking about an aging population where young people were leaving to find their opportunities. North Dakota's not like that anymore. We've become a much more dynamic state, and there are reasons why we got there. And there are things we need to do to keep it, though, because we can lose it. Things can change, and I don't want to follow South Dakota's path. All right, we got to stop it there. Remember, you can always leave us a voicemail, send us a text, 701-587-3141. Follow us on social media, YouTube, TikTok, Facebook, X. Plain Talk ND is our handle. By the way, we've been doing some cool stuff on YouTube in particular. We've been doing some extra videos. Chad and I talking baseball. Chad and I talking about our favorite governors, which was kind of a lot of fun. Some stuff like that. We also went back and looked at some of the early. Matt, I think to demonstrate his prowess as a producer, went back and had us react to some of the episodes I did on my own. That looked pretty lame and amateurish. So that's Matt. Anyway, they're fun to watch. They're on our YouTube channel. Go check that out. Subscribe to us on YouTube if you want. You can also find us on anywhere you get your podcast, Spotify, Apple, we're everywhere. You can find us, subscribe, review, give us a thumbs up, all the things. Coming up on Wednesday, we are going to have a research fellow from George Mason University who's an expert in AI. Now, we're not really going to talk about the data center thing in North Dakota so much, but more the perspective, since we are building those data centers and North Dakota is going to become a partner in sort of our AI future. What does that mean for our economy? What does that mean for people losing their jobs? She's actually coming to speak. She's one of the Menard family speakers at North Dakota State University. She's part of that speaking tour. That's coming up on Wednesday. Stay tuned for that. Otherwise, thanks so much for listening. Really appreciate it. Chad will be back in the saddle next week. But Pat, thanks for sitting in. Certainly appreciate it.
Hey, thank you. Always enjoy these conversations.
Thanks for listening, and we'll talk again. That's it for today on Plain Talk, the voice of North Dakota politics. Plain Talk is a production of Forum Communications Company. Got a question, comment, or suggestion? Leave us a voicemail or send us a text message at 701-587-3141. That's 701-587-3141. If you haven't subscribed to Plain Talk yet, you can find us on YouTube or your favorite podcast platform like Spotify or Apple Podcasts. For those of you who are already hooked, give us a rating or review. And don't forget to share or tell a friend. Special thanks to my co-host Chad Oban, and from myself and everyone at Plain Talk, thanks for listening. It didn't work. Nothing else is working. I don't know what else to do.